There are millions of people who have sleep apnea, who are not getting the healthy sleep they need, and insufficient sleep is a public health epidemic. For over 30 years, specially trained prosthodontist Dr. Takumi Kagawa and his team of dental professionals at Downtown LA Dentistry have been providing options to help their patients and their families get the healthy sleep they need.
Obstructive sleep apnea is a serious sleep disorder where you pause or stop breathing temporarily while sleeping. While asleep, the muscles of the mouth and throat relax, and for some individuals, the tongue and throat muscles block the airway. This deprives the blood of needed oxygen to the bloodstream. It is potentially a life-threatening medical problem. One of the most common signs of sleep apnea is loud snoring. Other noticeable problems is excessive daytime tiredness, dry mouth or sore throat upon awakening, morning headaches, fatigue, inability to concentrate, and attention deficit. There is an increased risk of cardiovascular disease, such as strokes and heart attack. It is often associated with high blood pressure, increased risk of diabetes, impotence, and decrease in quality of life.
Let's find out how Dr. Kagawa evaluates his patients to determine if they have sleep apnea.
I will do a thorough review of the patient's medical history and medications. I will be evaluating the health of the teeth, muscles, and the temporomandibular joints. I also evaluate the throat, palate, tongue, and tongue position, which may play a role in the patient's sleep apnea. This test is called the Malampati test, where the patient sticks his tongue out. His tongue blocks the view of his throat, indicating his airway may be compromised during sleep. From this exam, I will be able to tell if a patient is a candidate for an oral appliance. Written questionnaires, such as the Epworth test, also help evaluate the severity of the problem and is given prior to a sleep study.
Now, let's explore treatment choices that can help.
CPAP has been the traditional treatment for sleep apnea. CPAP stands for Continuous Positive Air Pressure. It utilizes a small machine which can deliver air at pressures designated for each individual patient. Many patients cannot wear the mask due to discomfort from the straps and mask, noise of the machine, inability to sleep comfortably, and restrictive movement. There are also surgical options. One is to alter the shape and tone of the soft palate. It is not often used. Another technique is to surgically reposition the upper and lower jaws forward. This is an effective procedure, but again, not often used. Oral appliance therapy is a relatively new treatment. It is often called the mandibular advancement device. Its success is as good as CPAP devices for the mild and moderate sleep apnea patients. One of the main reasons for its success is the compliance with patients. The oral device that I make for patients is a precision plastic device fitted on the upper and lower jaws as seen here. I have a device called the George gauge that measures how far a patient can move their jaw forward, and I set the device at 50% of the maximum protrusion. By doing so, I open the airway in the obstructed area by bringing the tongue forward. The tongue is the main obstacle, and since it is attached to the lower jaw, it comes forward as well. I will bring the jaw forward incrementally to about 70% of maximum protrusion. I will monitor the jaw muscles, the jaw joints, and the patient's bite or occlusion during the adjustments.
Treatment's been fantastic. Ever since I've been coming to Dr. Kagawa, I've noticed a change in my sleep habits. I used to have sleep insomnia. Now I'm sleeping more hours through the night. The biggest benefit is my snoring. I don't have a snoring problem, but my wife had a problem with me snoring, and now I no longer snore, so she's very happy with the fact that I have this appliance.
Downtown LA Dentistry, dedicated to your healthy smile and healthy sleep.